Welcome to AI Month 2023. My name is Petra Vorsteher. I'm co-founder of AI.HAMBURG, and I have the great pleasure to welcome to you an exciting day with 7 amazing panels and 23 expert speakers. I hope you will join us for all of them. Our session now is very important to all of us. It is AI in healthcare and how to save 400,000 lives per year with the help of AI. I will pass it now on to you, to our moderator, Ragnar Cruz.
Welcome to our AI in Healthcare webinar, How to Save 400,000 Lives per Year with the Help of AI. With me, I have 3 exciting founders of AI companies who help to make this with AI happen. Mark Hoffman from Cloud Doctor or Dr. Derma. Philip Nölling from DPV Analytics, and we were supposed to have Matthias Steffen, who is unfortunately not able to make it, stuck in traffic, who excused himself. Therefore, now Yuri Rode, head of Q&R at Fuse AI. Welcome. I would like each of you to introduce yourself in maximum 3 sentences, please. And let's start with Mark.
Yeah, my pleasure to join this webinar, and happy to be invited, Ragnar. I am originally I studied economics with international management and marketing, and I turned into digital topics, business and corporate development at the beginning of 2000, and finally since 2010 I'm in the startup business in the Hamburg or Europe-wide ecosystem, and focusing on startups and especially on digital transformation, and I'm in medical or digital health since 2021, and I'm really excited what's happening in digital health and the medical solutions, especially combined with AI, and that's me.
Thank you. Nice to have you here. Now coming to Yuri, please 2-3 sentences about yourself.
Yes, thank you. It was a surprise pleasure that I can participate with all of them. I study here in Hamburg biomedical engineering, and I start my career at the consultancy for regulatory affairs and quality management projects. And in this case, I saw this gap that the innovation engine for medical device and healthcare will be stuck because the regulatory affairs hurdles are very, very high and complicated. And then I start my career, I continue my career at the startups to implement quality management systems for the national certification. And then I looked up for the next step for the new innovation grade to see in the IA-based software for medical device, and it's very new for the medical industry, and I think it's a very innovative to step up in the next level of healthcare. And then I start my career for 2.5 years at Fuse AI, and it's great to see the progress, and I hope we can change the market.
So thank you, Yuri. Now coming over to Philip.
Thank you, Ragnar. I'm also like Mark, an economist by education, and I received my PhD actually for thesis on the international capital markets. So I originally wanted to study medicine and have an education as a paramedic, but then I chose to join actually bigger companies. So I was actually running big logistics companies like Hermes and DPD, but also was head of one of the biggest internet platforms for Gruner & Jahr. And now, since 2.5 years, I returned to medicine, and I have now the pleasure to lead the leading AI-driven heart care company in Germany, and to be modest, probably worldwide. unfortunately not by revenue, but I'm sure by technology.
We will make sure we get you there, of course. Yeah. Thank you very much, Philip. Now, as you just introduced yourself, please tell us what you're doing and what illness you diagnose and how easy is that?
Yeah, maybe just if you think about the most important death cases, it's by far cardiovascular. So 35% of all persons are dying of heart failure. This is more than every third person. So if we focus on your 400,000 saved lives a year, it's 5.5 million death cases in the EU 27. And that means roughly 2 million dying every year from heart failure. So the heart is the most important organ. If it doesn't beat for 20 seconds, you're dead. And actually our focus is how can we screen and how can we protect people from these early deaths? I mean, when you're 90, I think it's fair. When you maybe die from heart failure, but probably not with 50. So it's important that you detect the heart problems as early as possible. It's like an engine of your car. Once you start to hear something, it might be a little late. So you should detect it much earlier. And that's the reason why we set up a nationwide heart screening, which is unique. Our vision is actually a heart screening as regular service as it is, for example, blood testing at the moment. And to do so, actually, first you have to get the data. So that's the reason why we actually produce ourselves such a recorder. I'm not sure if you can see it. Sometimes it's a little bit difficult, but it's very light, it's very nice. And we have also developed our own patch for that. So you click it together, you put it on your chest, and that's it. You don't have to do anything, no button to be pressed and so on. So we developed this with a German engineer office, and it's reusable 1,000 times. Then the question is how to get along with all the data, because we have to record for 3 days. That's actually the medical recommendation to make sure that you don't have any problems with your heart, and we can detect everything. 3 days is 1 million heartbeats. So nobody can really analyze 1 million heartbeats. So that's actually where AI came in. So we are happy that we have already a certified software in place under MDR 2A, which is, for some people that know that this is not easy to get. And so at the moment, we are approximately having 1,000 examinations a month, increasing dramatically. And the last thing actually is AI is nice, but you can't really rely on treatment on AI. So we have our own cardiologists who are checking all the reports so that you get a fixed report at the end. Everybody can understand that. And you can then, if necessary, you can immediately start with the treatment.
Thank you very much, Philip. And now let's come to Yuri. Yeah. Yuri, what illness do you diagnose and how easy is that, please?
Our first indication, prostata cancer, and we are annotate and segment the gland and the lesion for prostate cancer. And we would like to extend to from the highest or high risk cancer for men. We would like to address the high cancer situation for women as well. We are plan and step to the next project in the breast cancer for MRI diagnostic for women. And we have collaboration and cooperation partners. They are thirsty for this technology in the prostate cancer annotation and segmentation. And we have a collaboration for in Switzerland that the physicians say that it's a quantum leap to have efficiency for time to help and support for the annotation and segmentation of prostate cancer. And this indication and this technology we would like to transfer for women as well. We would like to improve the healthcare, and we would like to increase the situation that we can live longer. That is the most high goal that we have. And I think that it's easy to adapt from prostate cancer to the breast cancer in the MRI image. And we see that medical devices, it's a very complicated product, and in an area that the financial or the founding and this basement is is even tighter, or we have a cost leverage in this situation, that the innovation engine for the healthcare market in the world are the startups. I think the big concerns or big companies would like to invest in this part, and I think we can improve, and we are the engine for innovation for the healthcare market, and especially for the radiologists.
Yes, so I like that. I always call the AI startups or the startups the speedboats of innovation. Yeah, we need these startups to actually get faster AI into our economy. And I think you're a good example doing so. I think prostata cancer is the most common cancer at men. Yeah, and of course MRT is quite usual, but we will come to that in a moment. Let's come to our next speaker, Mark. Please, what illness do you diagnose, and how do you do it?
Right, thanks. Double thanks, Ragnar. We are talking about dermatology. We founded Dr. Dermer last year. We are live since November last year, and my partner is a dermatologist, and he told me, and I think every one of us has experienced this yet, why should we wait for months or a couple of weeks for an appointment for something? What we like to know, is it something serious, truly serious, or is it something where I do not need to see the doctor? And this idea combined with AI, well, this was it, and it's pretty easy because every one of us got this. I don't know if you can see it. It's a smartphone.
Old? Yeah. Okay.
It's a smartphone.
Yes.
Yeah, it is. It's a smartphone. So it's easy. It's Dr. Dermer is basically a service, a web app, an app where you can take some pictures, take 3 pictures of your disease or what could be a disease, fill in a questionnaire, and basically that's it. So it takes only 7 minutes. If you're at home, if you're at work, if you are on travel, 5 to 7 minutes, and you're done. And you got your diagnosis within 24 hours. Our average is now 4.2 hours that you got your notification that you can download your therapy plan, your diagnosis, everything, which is even more service, which you can get at a practice, at a point of sale, we would say so. And to us, this is a no-brainer, especially dermatology, because skin is our biggest organ, and everyone got a smartphone, so we can really solve this big problem of appointments weeks in the future, and really talking about time. And this is, to us, time is the most, let's say, the most important currency today. And this is also what we see in the digital health market.
Skin cancer, diagnosing, and first of all, solving the problem that it takes way too long sometimes to get an appointment. You now found a melanoma, you don't know, is it good or bad? And of course, as a patient, you want to know immediately. You would love to get immediately an appointment, which sometimes takes weeks.
Right, and AI helps us a lot. By decreasing the time of diagnosing the patient. Only takes minutes, and it's much more faster. And also, AI helps to be more secure about a diagnosis. Yeah, to be more, even experienced doctors are facing those problems. And it takes always time to have a 4-eye concept or even 6-eye concept. And then we will, in the future, in the near future, we will also rely on the AI. This is our goal, on the AI as a pre-diagnosis instance and help and enhancing tool.
We have here 3 companies who have solutions in healthcare. Mark, your solution is already in the market. I understand you have thousands of patients already who have uploaded their pictures of their skin and got diagnosed. Yeah. Philip, you are also already in the market, so you got the approvals. Tell us more. How easy is it? Yeah, it's can I go to your website and you know and get diagnosed? How does it work?
Actually, it's also a story. So when we started actually with this nice device, it's not so easy to upload the data because it's a lot of data. So we started actually to sending it to customers from insurance companies, because the insurance companies, they can calculate. So we have 70,000 strokes a year in Germany, which comes from the heart. And they know this stroke costs on average 300,000 euros because it's a very heavy one, because the blood comes in directly and stops in your brain. So actually we send it forth and back. I'm coming from e-commerce, so I know how it works. And then actually we've also been contacted by a lot of people who said, okay, I'm not insured with this specific company. Can I not only also get it? So actually we made also our B2C channel. It's myritmo.de. We can order it. So you just click it, you order it, and then you get it the next day. Then you wear it and you send it back. And then you get in a few days from the beginning to the end, you get actually the report. And if we find something, our doctor is contacting you, and you can also book the doctor with it. We are now also in the practices, hospitals, and so on, which was not so easy because AI is one thing. But a lot of companies are also struggling with, if you have AI, how to get the data actually very reliable every day to your cloud. And we have a very nice solution with that, so it really works. We don't have to go anywhere anymore. It's remote. It's in a few minutes. It's really up and running. It's really plug and play and not plug and pray, as we said before. And actually, to enable everybody to use it, and we actually don't sell it to the doctors, but we give it to the doctors as a diagnostic, as a service. So this is actually a modern long-term ECG. I'm not sure if you can see it. It's ugly, you know. I mean, it has all the cable and so on and so on. A doctor has to pay 3,000 to 4,000 euro for such an ugly part, and then he has to pay 6,000 euros for the software. In essence, you have 10,000 euros, and you don't get it really reimbursed by the insurance company. So what did we do? We offer this very nice device. We say you don't have to pay for it. It's just diagnostic as a service. You can keys the contract with short notice, 4 weeks or whatever. So that really convinces the doctors, because it's not so easy to get in there, you know, and it really works. And in the end, they are now ordering more and more. So we start normally with 1, 2, 3 in the practice. Now they're up to 10 and 12 and 15 and so on and so on. So this is actually where we're going now in the B2B. But as a normal customer, you can very easily order. But a lot of people are coming to us with their smart watches. You see, I'm very well equipped. Huh? You can see it also, because we have meanwhile, believe it or not, 24 watches who can actually for 30 seconds get your ECG. The quality is okay-ish, and they're now queuing actually in our practices and say, okay, we have something maybe, and so on and so on. So this is normally the case where we say take the Ritmo. But now actually what we did, you might see it here. We just launched it 10 days ago. It's cardio check. So what does it mean in essence? Everybody can send its ECG from its smartwatch to us, cardio@myritmo.de. myritmo is our brand for B2C. And it receives within 1 working day its result, and it's checked by our doctors. It's very cheap. It's for 90 euro only. At the moment, it's free, so use it. You can just use it. Go on, send your PDF on cardio@myritmo.de, and you receive the next day your result. And the striking thing actually is we thought it's a gimmick, this thing, and so on. It's only 30 seconds, and what we found out now is that almost 50% of the recording we got were wrongly interpreted by the watches. So they can show something 30 seconds, but then they say you have AFib, and they don't have AFib, or they say we can't see anything, but you can see a lot of things. So it's also very important. So we try to be as easy as possible. We developed our own hardware actually to bring it into the market. The good thing is every doctor can use it, because at the moment, in order to have such an ECG, long-term ECG, you have to be a cardiologist. And you have to be specially trained. So every doctor or whatever can use it now, because we are the doctor. And also for all the others, we can also receive the data and put it through our AI. So actually, and this is scalable.
So very nice solution. I can confirm I tested it myself between the years. Yeah, I ordered it 2 days later. I had it. I put it on. You can even swap it when you're in the shower and so on, and put it on again. Really easy to use. I've done those other ones, what you just showed with all the stripes and so on. Not nice for a couple of days, but my Ritmo was really great. And what you are referring to, I think, important for the audience, everyone who has a smartwatch where they have this ECG, it actually on your device, on your iPhone or your Android phone, you actually are then able to get the PDF out of this 30 seconds. And that PDF then can be sent to you. And that's also an interesting detail, what you're saying, that often the watches don't really, they misdiagnose. Yeah. And so actually it's a good start. Send it then to DPV Analytics, do it all online and get an answer back, which helps earlier to actually detect. And for, you said 4.90, it's €4.90. Yeah, that's nothing. Yeah, and again, all happens quite fast. Great solution. Yeah, you are already in the market. Yeah, Yuri, coming back to you, I think your solution works. Yeah. But today, I'm not able to go to a doctor and actually use it because you are still in approval process. When will you have your approvals so that you can go to market?
Yeah, we are sitting in the last phase of the approval process with the notified body. We expect in the middle of June, end of June, in this time frame, that we have the certification for the quality management and the approval for the CE marking as well for the European market. And then we are localize the FDA market, of course. That is the next step. And the most relevant markets are in Europe and in the US. And right now, the biggest struggle for small companies, for startups, or for the big companies as well, is the EU MDR. And I think that it's a showstopper for innovation and technology. And this we would like to achieve. And then I think we have a good opportunity to enter the market for in the European countries and in the FDA.
Yeah, so you will be soon. I mean, June is next month. Yeah, so soon you also will be available, and then it's go to market. Yeah, and which will be great. So we have 3 solutions here who help saving lives. Only people need to know and use it then. And we need, as soon as Yuri Fuse AI is with their product on the market, we need to make sure that every doctor who has an MRT knows it's on the market. Because there comes another point. I heard from all of you in our prior discussions, the learning is also that when you do it traditionally, there are misdiagnostics. Yeah. So Yuri, as I have you there, what's the kind of percentage of if you have the old diagnostics without AI, how large, what's the percentage of misdiagnostics?
Exactly, I cannot say that it's 50% or we can reduce to 50% or for 55, what else? But we can reduce the time, and then the physician has more time to diagnose. And then it's obviously that we can reduce the misdiagnosis. I can say that we can reduce significant misdiagnosis for this in cases for prostate cancer. And then we expect that we can reduce our 50% of this misdiagnosis. Because if we look in the traditional way in this treatment, that for one lesion, we have 3 radiologists, that we have the situation 2 different opinions, and then we can reduce it.
I think for me important was, and I read all your papers and I saw the learning is that there's a misdiagnostics of somewhere around 14 to 15%, which of course is substantial, because normally if you do a prostata diagnostics, you do this every 2 or 3 years, depending on what you have, if you had any prior ones, or if it's in your family. What that means is, if it's 15%, then every 6th man who actually gets a diagnostic actually gets a wrong one, which means in 3 years, you might have real cancer, which is even more difficult to treat. And I know from people who got they got their PSA value, and then kind of were looking for treatments, and then for kind of comparison, because of course, when you get this kind of diagnostic, you want to know it really, and then want to know what needs to be done. So diagnostics is really important, and it needs to be as accurate as possible. Yes?
I would like to add something. The diagnosis is the base, but the treatment after then, that you get the biopsy, this is risky, that you get an infection, inflammatory, and then the physician or the surgery have to cut out your prostate. And that is very, very disappointed that you are healthy, but you are missing with your prostate is away.
Yeah. So this is life-changing and life-saving. So I hope that you will get your product as fast as possible in the market. I talked to Matthias prior, your CEO, and he says, hey, you have several vendors who actually have the machines on MRTs. Yeah, and don't want to spend now all the time, but I will come back to you in a moment. Mark, your product is already in the market. Yeah, and I think you want to more automate to actually do it also, being able to do more customers, and also is there a learning about kind of misdiagnostics? So you go to a doctor, and the doctor comes up with a diagnostics. Is there a failure rate when you go to a doctor today?
Right. I mean, diagnostic is not talking about dead or alive. This is more the business of Philip. But the story is, if you follow some studies, and if they are right, we have around, or we're talking about 25,000 bad melanomas a year in Germany, 25,000 patients. And from there, if you take this as a basis, approximately a third could be saved. Why? Because of the diagnosis of even experienced doctors, really very experienced doctors. They couldn't diagnose it properly if it is a bad melanoma or something else, which might be a good diagnosis, or something good, but it went out to be a bad melanoma. So this means, in numbers, 7,500 lives could be saved if the doctors would know faster and proper is this something serious, and then set up a proper therapy plan. 7,500. If you extrapolate, or if you take this number, and that if you would take it linear and say how big is the number in Europe, we are talking about 200,000. And we are talking about diagnostic, and everyone is, oh, this might be not such a problem. But have in mind, if we look at it very soon or very early, the chance of not getting into a situation, or patients getting into a situation which becomes very serious, it's a huge number. And this is why we are very happy that we launched the service with some automated or automatization in mind, with AI, etc., which will help right now our doctors, and also maybe external doctors a lot in the future.
No.
Yeah, right.
Really, really interesting. Philip, you're on hearts. Yeah, everyone has a heart, so it's relevant for everyone. Yeah, you are in the market, which is good. More people need to know, but effect to the to lives and analysis. First, also the question: do you have a number about misdiagnostics normally in the industry?
Actually, not really, fortunately. The problem is actually, I mean, we develop now case by case our AI. So we started actually with stroke prevention. We're very, very successful. And I mentioned that actually 70,000 strokes in Germany alone are coming from the heart. So we can actually, because you can treat them all before, if you know that the people are suffering from AFib, we can bring them to zero. So we just have to screen all the people. And in Europe, it would be then, I think, at least 500,000 from getting strokes. Yeah, it's not death cases always, but it's 30% or whatever. So that would really help. And at the moment, we're working on an AI for detecting the risk of heart attacks, which nobody in the world can. And we're very confident that we can do it. Why? Because I didn't say so. We've been founded by 3 leading cardiologists, and they're still practicing here in the Cardiologicum in Hamburg, which is the biggest cardiologic practice in Germany. So also our ECG is really top notch. So they're using it. They have more than 100 there and at the Cardiologicum. And actually, because we are now further developing all these things, we were trying actually other software for the intermediate period to use it. But what we actually have seen is, and this may be to misdiagnose it, you might have then actually a recording of 72 hours. And at the end, you get only 40 hours to be analyzed. Why? Because the system says it's too many artifacts. Artifacts is actually beats and so on. And these systems are mainly not really good, so that whatever they don't understand, they just cut out. And then you have the 40 minutes or 44, yeah, from 72 minutes, and it shows fine. And we're not doing that. So we have a very high sensitivity on these things, almost 100%, that we can really go into these things. And this is what we're currently working on. And the good thing is actually, and don't talk about your competition, but we have our unique database. We have more than 250,000 sets of our own patient database already, where we can actually train and retrain every day, because our doctors train from the practice and the labeling with the machine learning. And so whatever we have tested for the in-between, where we were thinking, okay, automate it and then let the doctor check, we decided it makes no sense at the moment. So a lot of things are not being seen. Coming back to the watches, I mean, it was 50% now. We are on the market with the cardio check for not even 2 weeks. I mean, this is you should rely on that. If not, a doctor has.
Yeah. So we need to help you to make it more public, so that more people start doing it. And and we need to get our insurances. We need our health system better in place, that they better promote those kind of diagnostics. Yeah. I think on what was interesting for me was also going back to Fuse, was if I have an MRT, you have hundreds of pictures to look at. Yeah. And I think one of the learnings was also for a doctor, there are improvements for him. So you have this machine which costs whatever, 1,800,000 to 1 million, and you try to do as much as possible with this. First, right diagnostics, and then, of course, then it's also business, as many as possible. Yuri, tell me a little bit, how does it influence now? How long does it take, or what impact does it have to the productivity of a doctor?
Yes, the normal annotation time from the physician is more or less that have several years of experience. For prostate cancer, 15 or 20 minutes. And then it's quick. And we can reduce the time to the half or less. And because we are sent the segmentation immediately, the radiologist does not annotate by himself, and he has all the marked gland, the marked lesion, and then he can decide, has time to diagnose. That is the important part. And then he is very, very efficient in this time.
Yeah.
And I think
that was...
we can reduce, I think we can double the patient cases for the prostate cancer indication.
Which means an expensive device like an MRI, you're actually able to increase the productivity. And what you're saying is, on a high level of accuracy, you can ensure that the diagnostics will be right. And it's not replacing a doctor. It actually first shows, here are the pictures, organs, and these are the points you need to look at. Yeah. And the technology, the AI, helps him to do that. And then he can make a decision. Yeah. And huge improvement. I always ask myself, why are not more doing this? Yeah. And please, in June, when you're on the market, I want to know to which doctor I can go. Yeah, here in Hamburg first, because I live in Hamburg, and I will tell all my friends, yeah, where can I go to get this diagnostics? Because I only want to go to doctors who use AI. Yeah, because I know now from all those kind of conversations, yeah, the probability for a correct diagnostic is much higher. You catch it earlier, you catch it right, independent from if the doctor on on a morning is sleepy or not, independent of age or whatever. Yeah, so there I want to go. So I will, end of June latest, I will reach out and ask, where can I go? And by the way, here to the audience, I hope I'm not the first, because then I would be very desperate about our health system. But to the audience, ask your doctors where you can use AI for this, and we will be happy to also point you to the direction and spread the word. Yeah. So I looked up also, looking at the clock. Yeah, we have 5 minutes left. I saw there were just one question which already was answered in the chat about the how many channels are used on the ECG. And I think if there are more questions, please type them in the chat and I will pick them up to address them here. Coming, let's say, kind of last statement, yeah, what to each of you, and I might start with Mark then again. What would be kind of the message from you to the audience? Yeah, if it's here or whoever hears this in the future, but what's the message you would give to them? What do you think is kind of important?
Classy one, sorry. First of all, from the point of view of Dr. Dermer, if you have any problem with a Dr. Dermer, and we will help you within hours. Furthermore, and this is far more important, especially at this panel, to say, trust digital medical solutions, not only ours. We are helping a lot, but trust those solutions, because in terms of time, in terms of convenience, in terms of preventive or control, services. This is the future, and it's happening right now. And you should be trustful, because we are not substituting any doctor or any doctor's experience. We are enhancing it. So as well as Philip said, we are working with doctors, and our doctors are working with AI, and it helps a lot. And trust them, give it a try. If you're not so trustful, it really helps in this discussion. That's it.
Thank you very much. Everyone talks about ChatGPT, but here is already technology at work to help people, to help saving lives.
Right.
Philip, your kind of closing words.
Oh, thank you for that. No, I think it was very clear, and it's very clear that we are all specialists in what we're doing. And when we see in Germany, we will have a lack of 11,000 doctors in the next years, and in the EU, 600,000 doctors. On the other hand, we have actually big progress in science. So I don't want to go to a doctor like you, Ragnar, who's not an expert in that. So go to the expert for skin cancer, go to the expert for prostate cancer, and go to the heart experts. And so we open that. And I mean, it's not only the doctors actually, but it's also the medical staff. And what we experience, I mean, if you look at this one, it's not only the doctors who like us, but it's all the staff, because really you go there and you don't have to wait. Normally with a normal ECG, you have to have an appointment, and you have to wait, and you're late, and it takes 20 minutes, and the staff has to put it on and so on. And here you just go there and they say, okay, you're Mr. Nölling, that's it, put it on yourself and bring it back tomorrow or in 3 days. That's it. And then that's uploaded. So it's convenient for everybody. And since we are also then, as also Mark said, we are the doctor then for the doctor. So because actually we can also then give a report and give it over to the doctor. And if he asks us a question, we can do that. And we broaden the field. I think everybody's broadening the field now, because we can give it to each and every doctor somewhere remote who had actually to send the person to a cardiologist 50 kilometers away or whatever, and wait for months until the person comes back. And he can say himself, okay, just take it, make it, and I send it over to DPV, and that's it. Sorry, too long maybe. Just Ragnar, sorry for that, but I think in the chat there was a question, and the person couldn't read my answer. So it's 3-channel, and it's certified under MDR 2A. Very good quality actually, so it's better than the old one. So that's the reason why we have several hundreds now in use and practices.
Yeah, thank you very much.
Ragnar, may I add?
We need to. Sorry, it's we are now better on our time. Yuri is the next one. Sorry, that's my task to kind of divide it. We do another session where we give you more chances. What about that, Yuri? Now,
okay.
you.
I think diseases and health is so important that we have to reduce the impact of diseases in our life. So health is the base to explore, to achieve something in our life, and we would like to improve this diagnostic way for cancer in the worldwide opportunities that we can change the world in the cancer diagnostic for MRI as well, or for other radiology image. And I think that we can bring the change for diagnostic in the imaging parts of medical device. And then we are I think the AI-based software it's a good idea, and it's not a component to the physician. I think it's the best is the combination.
Yeah.
Well,
thank you.
Thank you very much. Thank you, Ragnar. Thank you, Philip. Thank you, Yuri.
Wait. I wanted to conclude, because we came with a promise. How can we save 400,000 lives? Now I need to speak a little bit faster, but we've shown that in Europe, it's nearly 500,000 people where we could save just with Fuse AI's MRTs, 200,000 with Dr. Derma, 180,000 with DPV. That's more than 800,000. I promised 400, it's more than 800,000. He has great talent, great companies. Everyone out there, every doctor, our health industry, look at these companies, look at these startups who have solutions to help us saving lives and save the world. Thank you, Petra.
Thank you, Ragnar. Thank you, Philip. Thank you, Yuri. Thank you, Mark. This is a topic that's very close to my heart. We need to spread the word. And I think we started doing this right now, and we will continue. And a little advertising blog for the next session at 3 p.m. It's AI-powered human resources. AI intelligence boosts your workforce. I hope you can join us all there, and see you shortly.